It's been many months since the first COVID-19 case was seen in Washington state, but the pandemic is far from over. We've heard a lot about the importance of staying home, and that's still the best thing you can do, especially if you're regularly with the elderly or people with weakened immune systems. You also shouldn't go anywhere if you have any of these symptoms. But if you do go out, keep in mind, location matters. We'll go over a few popular ones, but in general, here are some things to think about. And as always, wear your mask. The big one is how packed the place will be. We know that COVID-19 can spread through the air, so the density of each location matters, especially if you'll be doing a lot of talking, shouting, or singing, or where you won't be able to wear a mask for food and drink. You also need to think about who you'll come into contact with. Ideally, it'll be people you exclusively live with because you don't know whether a stranger has been exposed. A study found that about 1 in 3 COVID-infected people don't show any symptoms, so it's not as easy as looking for people who are obviously sick. Next, are you going to be inside or outside? Outside is better, but if you do find yourself inside, pay attention to the airflow. You'll want to be somewhere with open windows since how air moves can increase how far COVID virus particles travel. It's also going to be safer to spend as little time as possible at each place. Your transportation matters too. Again, you'll want to minimize the number of people you come into contact with, so taking public transit and walking on crowded streets is riskier. Driving depends on whether you'll be picking anyone else up. If you are, it'll be best if you keep your windows open, because we want to maximize airflow. Also, try to keep recirculation off. Lastly, keep an eye out for the current state of things in your community. Look out for the test positivity rate, or the percentage of people tested that actually have COVID. In an ideal situation, the WHO recommends that number be below 5% for 2 weeks. At the end of the day, it's still safest in your own house. So when you do go out, take the virus seriously. COVID-19 can have long-term consequences like problems breathing and extreme tiredness, even for you. Keep watching for some examples on what's risky and how you can stay safe.